I have patients coming to me all the time saying, doctor, I think my base is wide and I wanted to narrow it. Sometimes it is true, sometimes it's wrong. How do you know actually that you need alar base reduction? There's all these measurements that have been done over the years to actually discuss or decide which of the base that need to be reduced, and this is standardized. In essence, or to make it very easy, one very easy measurement is that the width of the alar base, so which means from here to here, is equal to the distance between the eyes or to the size of the eye itself. That's a very easy way of describing it, and most people can look at it and decide if the base is wide or not. But then there are situations that you actually see something different when the base itself is wider in the front here, and then you need to reduce it. But it's all also dependent on what kind of rhinoplasty you do. Sometimes you work on the tip, you change the shape of the tip, and then suddenly the alar base will look slightly different, and you do something to do into it. And the main one of these situations is when you reduce the tip length to the distance from the tip to the face, this area here, which you see in the profile more. If you reduce that backwards, we call it a projection. If you deproject the tip, sometimes you find this alar base gets wider. Imagine yourself pushing a tent backwards like this. It will enlarge from the sides, and that's what happens. And in these situations, you explain to the patient, would do this. The main thing about this operation is that you actually create external scars. So that's what worries a lot of the patients. But you have to be careful how and where you put these scars. What we do is we tend to put them in the shadow areas here, so they are hidden. Initially, when you see them, you can see the scar, and the color of the scar is also different because it's slightly pinkish in the beginning. But later on, when it heals, it's hidden within the tissues of the shadows of the side of the nose and is not seen that well. So I think it's a very safe surgery, but it has to be chosen properly and carefully with each patient, and when to do it, and how to do it, and where, and which operation you do it with. Thank you.